2 minutes somewhere. Okay, go for it.
Okay, all right. Those of you that have heard about TTIP know that it's a US takeover of the EU, and you've probably gathered by now that the EU has been behaving itself terribly nicely up to now so that we all love it, but in truth it's a power grab by the trade lobby. We are losing our national administrations, it would seem, towards a Brussels organisation where there's rubber stamp voting only, and really everything is decided by the same people who are bringing us TTIP. As part of the TTIP negotiations in Brussels, an instruction went out 3 years ago that all European countries should harmonise the rules for their public services with US rules on the same sectors, and that the priority sector for that harmonisation was the health sector. That is why we had the Health and Social Care Act 2012. That is why they're forcing through their privatisation that started in the Thatcher years. That's why they're forcing it through very fast now. They're working against the clock. This relies on the country maintaining its ignorance for just about another few months, another year. It is possible to turn things around if everybody understands what's going on and stops believing the lies. Because what we have here is a giant episode of corruption which is being brought to us under the disguise of democracy. We need to recognise it for what it is ourselves. We need to spread the word so that people understand that we are all in the same situation, those of us who are paying for the system and who wanted to use the system. Those who think the rich will be all right under the new system, those people are wrong, and we need to educate them urgently, because the fact is, relying on the private health insurance industry for your health care is frequently a fatal matter and generally an impoverishing matter. So we need to spread the truth. They are expecting us to carry on being flummoxed by the media lies. We need to get our act in gear and spread the truth through alternative media, by word of mouth, by everything we can, by educating the journalists. The people at low level have been tricked too, and it's possible to educate our way out of this, because many journalists, we have journalists on the Daily Mail, as a young mother who's disgusted about what they're doing to the hospitals, and she keeps publishing exposés of A&E closures and deaths and all kinds of things that are really damaging to the privatisation. If we all of us get to every journalist we can find, then that's going to happen more and more and more, and it becomes political poison. And you know, these people have committed crimes and there is evidence of those crimes. They need to be made a lot more afraid of being relocated to prison. That is probably the only thing that will stall it in the end, to make them know that they are being watched. This is evidence of criminality, and another vote for another giveaway of privatising the NHS could be the thing that actually gets the evidence together to send them to jail. Okay. The PFIs are fraudulent. We have been thoroughly ripped off and lied to. We get the word out, and then we need to mobilise around that. Divide and rule has worked for far too long, but I think people are understanding now and investigating the power structures in this country. We are being conned en masse. We need to take the NHS back, spread the word, and it's doable.
Okay, thank you guys. Okay.
Final very short soundbite. Look at what Iceland's been doing. They're jailing bankers, they're jailing politicians. We need to get on with it.
Okay. Can you give a second version on the Efford Bill, because people have been sucked into that?
Sure, okay. The Efford Bill is being sold to us as the salvation of the NHS, because in one part it takes away the competition rules. Sadly, it puts them back in another part. It's a nasty con trick. It gives a guarantee on TTIP, which means nothing at all but looks very consoling. And then it sets up an arrangement for an American insurance company to take over monopoly provision of GP services, of paying for GP services and for arranging those services to be correct. So the insurer that takes over monopoly control of that will also have access to all of your medical notes, and they're doing that because that's commercially valuable. Our political parties are colluding in a cross-party effort called the Efford Bill, which says it's the salvation of the NHS, but what it actually is the Gift to United Health Bill, and we should not be supporting it. We should be exposing it and the people who brought it to us as fraudsters.
Okay, thank you. Thank you so much. Okay guys, if you could actually tweet this everywhere, LinkedIn, and you know, any nurses in LinkedIn, doctors, send it to them. Thank you so much. Peace out. See you later.